This event was especially important for RAMA because at the conference, the Russian-American doctors elected a new president. We had an opportunity to talk to Dr. Yevgeny Hovkin, a neurosurgeon from Las Vegas, Nevada, and the immediate past president of the association.
Why are you here?
Well, I'm a past president of RAMA, Russian-American Medical Association. I had been president for the last 2 years, up until about 2 hours ago. I got reelected, and Dr. Elgudin took over, who's a remarkable person. So we're all looking forward to working under his guidance. And this is the 7th meeting. This is the first time that we actually have a combined meeting between 3 organizations. We're very excited about this. We think it's a historic event that's certainly going to set the grounds for this unprecedented growth in our organizations.
And what does it mean, RAMA, RASA, and RADA for you?
Well, we have been redefining, as a president of this organization, I had been very much in favor of redefining how we look at this organization. Whether it's a means to educate young people and help them in developing their professional careers, whether it's a social club that allows people to interact and to develop new relationships professionally and non-professionally. Whether it's a organization that helps international work and focuses on the projects abroad, primarily in former Soviet Union. So I think it's all of it. But I think what the main thing about our organization is that it's a collaboration. It's something that it allows us to develop friendship, to move towards common goals based on the common interests, and that's what I think RAMA is all about.
So, and what should be the next step?
Well, we have a lot of interesting ideas, a lot of interesting projects. For example, next meeting we plan on doing this on the West Coast, and we are trying to attract physicians, Russian-speaking physicians that are on the West Coast that are less likely to come here to the conferences here. I just recently moved to Las Vegas, so I'm certainly hoping to be the host of the next meeting. We're going to discuss this later on at the board meeting and make a decision where the next meeting is going to take place. But I think that would be the next step, is to move to the other part of the country and also continue working on the international projects that we have.
Okay. Thank you so much.
Dr. Yakov Elgudin, professor of cardiothoracic surgery from Cleveland, Ohio, was elected the next president of RAMA. We spoke to Dr. Elgudin outside one of the conference rooms.
So what are you doing here?
I am here for the conference, for the biggest meeting of the year. The Russian-American Medical Association, the Russian-American Science Association, the Russian-American Dental Association get together once a year and sort of have a big discussion of what's going on in this area. And this is the meeting we are here in Chicago, in Washington for.
What is the RAMA, RASA, and RADA for you?
It's an interesting question. I think that's the way to channel the passion and interest and love in doing something for your own soul, for your own heart, out of your own heart. It's not really a professional group. It's not really a association by professional interest. It's just because we love what we do. We love giving back to where we came from. We love doing something for, how they say, for the heck of it, just because we love it, just because there is such a great reward of doing good things.
And what should be the next step?
I think the next step, at least for the American Medical Association, Russian-American Medical Association, I think the next step is to bridge the big gap between education and healthcare that exists between Russia and the United States, or Russia and Western Europe. And what we can do is to deliver this education in a very specific and meaningful way, to bridge the gap and have most of the Russian people get access to the healthcare and medicine that they deserve.
It was very interesting to hear the opinions of doctors and scientists who had come to Washington from Russia for the conference. Dr. Gennady Moiseyenkov, Chief of Staff of the Kemerva Heart Center, said,
Скажите, пожалуйста, почему вы сегодня здесь?
Ну, во-первых, по приглашению Русско-Американской медицинской ассоциации, и поскольку у нас есть совместный проект, который мы считаем успешным проектом по развитию детской кардиохирургии в Сибири, и в частности в городе Кемерово, поэтому я и принял любезное приглашение Якова Львовича и доктора Виноградского. Приехал на эту встречу.
Скажите, а что для вас лично значит РАМА, РАСА и РАДА?
Ну, РАМА для меня лично значит то, что это вот она ассоциируется с тем проектом помощи детям с рожденными пороками сердца, который начал и успешно развивается в Сибири. В первую очередь РАМА у нас ассоциируется с десятками детей, которым мы смогли помочь, и которым мы вернули жизнь, здоровье. Вот что такое РАМА в моем понимании.
И на ваш взгляд, какова должна быть следующая ступень, каков должен быть следующий шаг?
В первую очередь должно расширяться сотрудничество, потому что от каких-то частных вопросов, врожденные пороки сердца – это важная проблема, но тем не менее это частный вопрос развития медицины. Надо переходить к более широкомасштабным проектам, которые могут иметь своей конечной точкой какие-то научные, фундаментальные решения, серьезные совместные работы научные. Надо объединять в первую очередь не физические усилия, а мозги, знания надо объединять. Потому что когда вместе коллективный разум всегда сильнее индивидуального.
Спасибо.
Dr. Larisa Petrenko, head of the Russian company Professional Medicine from St. Petersburg, answered our questions.
Лариса, скажите, почему вы здесь сегодня?
Мы хотим сотрудничать с американскими, русскими врачами и хотим установить контакт между российскими врачами, нашей ассоциацией, которую мы представляем, и вашей ассоциацией. Это основная задача.
Скажите, пожалуйста, что вы думаете о РАМе, РАСе и РАДе?
Вы знаете, что я глубоко впечатлена тем, насколько эта ассоциация большая и идет широкий охват не только врачей практикующих, но и врачей, связанных с наукой, и отдельно по специальностям, как стоматологическая РАДА, да, Организация русско-американских врачей. Мне кажется, что это очень правильно, объединение таких крупнейших представителей различных профессиональных направлений в одну для координации их деятельности. И я бы еще создала четвертое направление. Это направление, связанное с управлением, с менеджментом, которое является обязательной необходимостью для управления такой огромной организацией, которая сейчас уже представляет РАМА. И продвижение интересов ее в более уже масштабном направлении, и это очень важно.
И что же, по вашему мнению, должно быть следующей ступенью?
Ну, как вот я вам сказала, это организация управления в менеджменте. И следующее, выход на такие же организации в России, кто именно возглавляет или организует именно управленцев, менеджментов, выходить на более высшие уровни, не просто врачей, а уже организаторов, для того, чтобы скоординировать больше вещи, более широкомасштабные сотрудничества, потому что мы понимаем, что врачи очень много значат, но поддержка главных врачей, поддержка руководства, поддержка комитета по здравоохранению на местах, да, власти муниципальных отделов, которые отвечают за здравоохранение, это очень важно. И без их поддержки многие проекты могут оказаться не то что невостребованными, а не реализованными. А наша задача все-таки реализовывать их в практическое здравоохранение и улучшать здравоохранение, как в России, и обмениваться опытом здесь у вас с американскими врачами. Поэтому, естественно, выход на новые уровни, да, и воплощение ваших проектов, потому что то, что вы сделали и делаете, это замечательно, это достойно всяческие похвалы, и я восхищаюсь.
Dr. Mariano Chabano, pediatrician from North Carolina, and Colonel Norval Coots, MD, commander of the Walter Reed Army Healthcare System in D.C., shared their ideas about their cooperative work in Moldova.
What are you doing here today?
I'm attending the RAMA, RASA, and RADA conference. This is the first time for me. I've been very interested following what this organization is involved about over the years. Basically, since 2002, since you guys started working, I've been following the updates on the website, but this is the first time I got a chance to come, and I was very interested in presenting our partnership projects that we develop in between Moldova and North Carolina. That's why I'm here.
So what does RAMA, RADA, and RASA mean for you?
I'm very proud to finally be able to be associated with the Russian-American Medical Association, and it's a pleasure to see how quickly this organization is growing and how more projects you guys doing. I think it's very important for us, physicians, scientists, and dentists coming from former Soviet Union Republic, have this opportunity to join our forces and have an exchange of ideas and projects.
So, and how do you think, what should be the next steps?
My wish, if I have a wish list, will be for RAMA to become a partner with our partnership, Moldova-North Carolina bilateral partnership, and maybe we can do some joint projects. RAMA can have a joint project in Moldova, where we can have a joint project in Russia. We're very interested in future collaboration.
What are you doing here today?
Well, I'm Dr. Van Coots, and I'm here with Dr. Mariano Chabano to talk about some humanitarian service cooperation projects between the United States and the Republic of Moldova.
So, what does RAMA, RASA, and RADA mean for you?
Well, this is a great partnership between the Russian-American physicians and sister partnership states and the United States in general in working with the former Soviet Union, in Russia specifically, and in some of the emerging former Soviet republics. And specifically for me, again, it's working in partnership with the Moldovans. And I think the humanitarian aid aspect of it is very important, and that's what I represent here today, working with the disenfranchised youth, the children in Moldova and in the former Soviet republics, helping them with their health care, with their education, but also helping to protect them from trafficking.
So how do you think, what should be the next steps?
Well, I think that the next step should be continuing to partner with different aid agencies in the United States, different private charities in the United States, and through the U.S. Chamber of Commerce, and through sister partnership states such as the Moldova, North Carolina partnership. I think that we're well on our way. We've been doing all of this for about 10 years now, and so we've learned a lot of lessons. And I think the future is just to continue to partner and to work even harder.
Thank you so much.
Thank you very much.